Good evening. What's happening? Almost forgot myself. Cole is supposed to pop up here in a second. Let's see if she having problems. She should be popping up here in a minute, unless she's having technical difficulties again. Hope everybody is well. This has been a week. Oh, Jesus. It has been a week. So I outdid myself yesterday and probably had it's not probably the largest and the most difficult fibroid surgery to date. So you all will be hearing soon about that, but it tests me to my limits. Hold on, now my mom want to hop on here. Let's do that. All right, it's funny. Going live. You're going live for the world. You know you asked to join the live, right? So you on?
No, your daughter asked to join the live.
Oh, wait. Hey, we have a tech. He can see you.
Oh.
Yeah, I can see you. So y'all live in the world. So there go.
There we go. Stop doing the get up show.
Damn.
Please. Stop doing that.
Okay.
That is so uncool.
So I say hi. Bye.
Goodbye.
It definitely was you. No, it said that you asked me to co-host, but when it wouldn't let me click on anything, it just the message came on the screen.
Oh. Yeah, they got on.
Oh, okay. Well, see, they jumped the queue.
Cute. But
so
no,
what I miss?
Nothing. I was just telling them like I had the biggest fibroid, the most difficult case of my career yesterday.
Oh wow.
Yeah, it was tough.
See, so now you don't have to keep saying that I'm the only one.
She made you look like nothing. It was 20 pounds.
Like a golf ball.
20 pounds.
Wow. 20? And it was just one or collectively?
It looked like it's. I'm gonna tell the story later. Like
okay, we'll wait. Then we won't. I won't force you to tell. I'm like, I want the tea. No.
But it was everything. It was tough. 20 took over her belly. 9 centimeters. She probably had about 59 centimeters. No, but it was. I haven't seen anything like it.
Wow.
Anything like it.
Well, I'm glad she found you. Is she Chicagoan or out of state?
She drove because she couldn't because I don't get too much about history, but she had it was so large that it was compressing on one of her major veins called the IVC, and so it was causing pleural effusions or like fluid on her lungs and belly. Like so, one of her lungs literally had like 3 liters worth of fluid on it. She's had to be drained multiple times, but she's went for 12 years and nobody would touch her. Nobody would do anything. So I say I'm GOAT. Like I'm 1-on-1. Like she's gonna get on in the test, but like these people go all around. Like they go everywhere. Johns Hopkins, Northwestern, Mayo Clinic, all of these places they go and they won't touch these people. Like so these few women, it's not a lot of them, but women that have like really advanced fibroid disease, like they are stuck in purgatory for years, especially Black women. And it's really it's disheartening, like it's sickening to me. And I literally had to fight with the anesthesiologist and people to like help her. Nobody, even in my hospital, when I'm like had her here, everybody was like they wouldn't do it with me. They would not. They like put it off. It was one because she's supposed to have her surgery on Tuesday, and the anesthesiologist, like I had the anesthesiologist picked, handed out, ready to go, and um, I had to drain her lungs again because it had reaccumulated. So when she came in, she had fluid on her lungs. Had to get it drained again. Pushed her surgery back, and then it shift changed. So it was a new anesthesiologist, worse than the world. He basically got her case pushed back another day. So it was like, but it was. I'm gonna talk about it. I'm gonna get her on the live so we can both talk about it. But
Yeah, I was definitely about to say, like, would she be willing to join? Because
I think
that's
so.
an
Right now,
amazing
yeah,
story.
right now it's like because it's gonna be a write up on it, and it's crazy. Like I said, I've never seen anything like it. It was stuff in there that was like crazy for me. So and so I say like now, but doing it again, it's like it gives me. If I could do that, it's nothing. I can't. It's not. It's no. There's no case that I won't take. I'll do any case. I'm good. It doesn't get any worse than that.
No, I think that's amazing that you even are willing to challenge yourself because some people get stuck in this my niche. I'm only doing this. I'm not going above this. Don't ask me. I'm already doing enough. And you still say that you understand the impact or the suffering enough that you're willing to even challenge yourself so we could feel better. Or not just me, but we, like collectively.
Um, just in quick, how long did it take? I mean, it took even longer because, and I don't want to tell too much story. I keep like people
I
tell,
know
but
they go. I'm telling you, everybody wants the tea.
but short, I'll say it was complicated because a portion of her fibroid had adhered to her bowel. So like her bowel was like literally attached. I got everything out and then it was attached. And so I had to call general surgery to take out a small section of her bowel to reconnect that bowel. So it was crazy. But I got it out, incision like literally this big. Like it's crazy. Absolutely. But we'll talk about that. All right, somebody want to hop on. Like, you want to hop in this?
Okay. I guess I don't need no intro. People already know what to do.
So whoever asks about billing outside of 5,000, 5,000 is only if you want me to schedule you tomorrow or within the next 2 weeks. You don't have to pay me extra money to get on, but my schedule is so insane with people like this. If you need expedited service and I gotta spend my day um, already on top of what I've already scheduled, and you need to be scheduled, then yes, I'm going to get paid for that. So that's where that is. But it's not, oh, to schedule surgery with me, you got to pay extra money or whatever. No, you just get on the schedule when you're on the schedule. That's like a jump the line fee to inconvenience my entire life for the day. That's what that is. Nonetheless, let me let somebody on here. Should I let this fool on? Hold on a second. This is my boy right here, comedian. He gonna get on
Oh.
I just,
but
you
I
know,
don't even jump. I don't hop on your live. You do these
what?
little. I don't hop on your.
What? I'm coming in with a testimony.
Bro.
Listen,
I don't even do you.
Dr. Johnson had pulled a fibroid out of these nuts, and I can't listen.
Come on.
I mean, there was nobody else. I was able to go to him, and he pulled it out. And thank you, man. I wouldn't be here if it wasn't for you. So please go see him. All right.
Is that your son that you ever talk about?
Yeah. Yeah, this is. Oh, he ain't. Well, go put some clothes on. What the hell going on, man? I'll put some shorts on.
The amazing LeVar Walker, everybody. Go ahead, get your shot,
Well,
man. Go ahead.
I wanted to say, for y'all who don't know, Pierre's my oldest son. You know, it was unfortunate. Listen, it was
Hey,
unfortunate.
somebody said, did he get it all out? No,
When,
what you call them the people
listen,
on Game of Thrones that don't have no
when,
nuts?
when I had Pierre, I was 13, and I couldn't I couldn't be in his life, but I'm very proud of him.
Cheap.
Man, the kids on live are the best. Like, I love all this energy.
Oh, geez. Hey, no, you see my mama talking about say what, LeVar? Go ahead. See, you got my mama on here talking crazy.
I was 13. I couldn't be a father.
I'm on here, dumbass.
Oh, she is?
Yeah, she on there talking about say what, LeVar? You all see it?
I just left from over there. So
hey, come on, hey.
Over there. She know what's
going on. Hey.
Jay.
Okay.
James Kingdom. We're going to another Super and we're winning.
I'm going for the 49ers. We got a bet right now, so.
Everybody.
One penny?
Hey.
Yeah.
All right.
Hey, don't start getting mad when he grow up and start looking like me, man.
Yeah, whatever, man.
I'm not paying child support either.
I mean, listen, I'm your father. I'm his dad, you know. He probably will.
Hey, man, you interrupt my lot, man. We're going to talk to people.
Go ahead, do something out of here, guys. And listen, if any of you are in Arlington, Virginia, I got to sell these tickets. I'm going to be at the Arlington Draft House March 1st to the 3rd. Click the link in bio, get those tickets, and go to Dr. Johnson, the Fibroid Slayer.
Goodbye.
That's hilarious. This son was on it. All right. So
let's get questions.
Okay. Yes. So thank you all for joining. Welcome back, some of you all. Welcome for the first time, some of you all. We are trying to watch the clock tonight. So if you have a question, please put it in the question bubble with the question mark at the bottom of the screen. You also can request to join, but tonight we got to do many free consultations. So if you got questions, don't bring the full list tonight. Bring like one or two, and we got to go to the next because we on a time crunch tonight. As you can see, Dr. Johnson still got scrubs on and everything. So we gotta be respectful to the time. All right. First off, so this was actually somebody that wanted to clarify that question. And they typed it wrong when they submitted it before. What is the difference between eSure and UFE, and why was eSure discontinued?
All right, big difference. So eSure, it was a permanent sterilization procedure in which coils are put into the fallopian tubes hysteroscopically. So basically, you put a camera into the uterus, and you thread these coils into the fallopian tubes, and they scarred the fallopian tubes. This was a permanent sterilization procedure. It was taken off of the market because there were women with multiple side effects, and a lot of those happen to do with allergic reactions from the coils. So women have multiple different reactions to it. I performed it multiple times. I didn't have many women that had problems, but I did perform surgeries on women that had problems and had to remove tubes. And I actually had a classmate from high school that came to me last year, and I had to remove the coils from her. So that's eSure. And ablation, did they ask about ablation?
No, they said the difference between that and UFE.
All right, so UFE is uterine fibroid embolization. So uterine fibroid embolization is a treatment for fibroids. Women that have fibroids, it maps out the blood vessels to the fibroids, and basically an interventional radiologist cuts the blood supply off to those fibroids. So two totally different procedures. Don't get confused with the terms. So terms that sound very familiar: ablation, embolization, right? Those are two different things. So if you ever hear the word ablation, it's very different than embolization. So an endometrial ablation means to like cauterize or burn, treat with heat. So that's different. Whereas like an excessive procedure, which is a uterine fibroid ablation. So it basically is burning a particular area. And embolization means to cut off the blood supply or cut off the access or supply to something. So uterine artery embolization is really cutting off the blood supply. And again, y'all know I'm not a fan of UFEs. And UFE and UAE are the same thing. Uterine artery embolization, uterine fibroid embolization, they're the exact same thing. It's just cutting off the blood supplies of fibroids. Cutting off oxygen to tissue hurts. Typically, there are some women that have had successful UFEs, UAEs. God bless them. I speak from experience from looking at my overall patient population, to where if you give me 100 patients that have had UFE, UAE, which I've seen them, there are very few of them that had success from it. More often than not, they have had pain, recurrent issues and symptoms, and I end up having to do myomectomies, hysterectomies on these patients that have had them. So that's why I don't recommend UFEs, UAEs for my patients or with my family. I look at it the same way. What I tell my mama, who's on here, when I tell my mama to do this surgery, if the answer to that is no, I wouldn't tell you to do it. You know, if I tell my sister to do a surgery, if the answer to that is no, I'm not going to tell you. I talk to every patient like they're my aunt, mama, or sister, like real talk. And I'll, however it is, I have to break it down to you. I'm not going to recommend something that I don't personally agree with or would tell my own family to do.
All right. One of the questions in the chat, I finally got to book with a consultation with a fertility specialist, and he said because I had UFE before, he can't help me get pregnant because there are plenty of risks. About 16% ruptured uterus, miscarriage, and preterm babies. How true is this, Dr. P?
I would get another consultation, right? So, you have risk associated with any and everything, but there are women that undergo fertility treatments that have had UFEs. So if that doctor is not comfortable, I would definitely get another opinion about it. So I think that's just maybe that doctor's opinion. Everybody has opinions, and I guarantee you will find a provider that will treat you with fertility medicine after UFE or UAE. So all hope isn't lost. You just got one opinion, get another one.
All right. What is the likelihood regrowth after?
With that, if you are in Chicago, and I have to put a plug out, for my friend and colleague, Dr. Erica Loudon with Kind Body, is who I refer like all of my patients to. Her page is awesome. She talks to people just like I talk to them. Black woman, super down to earth. So anybody that's there, I give her a shout out because, like I said, if I trust you and if I send my mama, my auntie, my sister to her, I would send my patients to her. So anybody in the Chicagoland area, Dr. Erica Loudon at Kind Body is a phenomenal fertility doctor if you're in the area.
All right. What is the likelihood of regrowth of a fibroid after an open myomectomy? I have one that is 6 to 8 centimeters getting removed next week.
So I say this, and this is my philosophy, and this is my belief. So it's more opinionated and not as much rooted in facts. And it's hard to root it in facts because it's very difficult to study. And my opinion is this: if you remove all of the fibroids during the myomectomy, not just the ones you see, not just the ones you feel like, but the ones that every single one, all of them, if you remove them all, the chance of those fibroids now regenerating and forming new fibroids that are large enough to become problematic is low. You just don't have enough time. Even if you're in your 30s, you just don't have enough time for them to start off scratch from zero to then grow big enough to be a problem. The issue is that surgeons are not very thorough with myomectomies, meaning that you'll go in there and they'll see fibroids and get the fibroids that they see. Even with open myomectomies, they're not in there palpating or feeling the uterus and getting all of the fibroids. If you see my pictures of my surgeries, I literally have, fibroids that are, like the tip of this pin. Fibroids that are like this. You have to go in there and you have to feel, and get every single fibroid particle out, if you get that, the chances of them of them growing from scratch, because now they're gone. Now they have to grow from scratch and then build themselves up to get big, are nil to none. I just have not had that experience. Like about the patients that I've actually done this surgery, which I've been doing it again. I stopped doing robotic myomectomies done this way about 5-6 years ago. I'll tell you guys, there hasn't been a patient that has returned to me with advanced fibroid disease with doing that. So, and answering the question specifically about women, that if you go in there and you do surgery, you get the myomectomies, you're like, will they get bigger? Yeah, they'll get bigger if you don't get them all. Keyword, getting them all, getting bigger, right? That's very, if I start off at a marble, that marble can grow in size. If I start off from zero, starting all over and getting bigger is much, much more unlikely. So with that, you need to be very thorough with your questioning of your provider and ask them like, hey, what is your approach to getting all my fibroids? Like, are you going to be in there and you're going to pick out and look at every single fibroid that I have to try to get everything out? And if the answer to that is yes, then I will be more comfortable. They're like, I just get the ones that I see. I will start looking for other providers, put it that way. And like my residents that with me, they know like we just gonna be in here because I'm feeling. And then when I felt enough, I step away, I let them do it, and I come back and I feel it again. But all the time I do that, I always get more little particles of fibroids. And if you get them all out, as I say all the time, you get them all out, the chances of them growing and being a problem in the future are nil to none. I stick to that.
All right. Is it true that you can tell by the placenta how many kids a woman can have?
No,
Okay.
not true.
Is it true that a fibroid is hard to see during an open surgery if it's in the muscle?
Not if you feel it. I think that's false. If you know what you're doing and you're feeling and you're experienced to feel them, then yeah, it's difficult. But if you're experienced, you should find them. Like I said, I will find fibroids the size of pin tops or pin cap. This literally, I got fibroids that are like this just from feeling. So if you can feel it, you can get it. You just got to know what you're feeling for. Um, and you have to be able to manipulate the uterus in a particular way to be able to get everything. For instance, like I just had a case where I didn't, like, the majority of the patient's fibroids were on the external part or uh, the muscular part of like the, and I'm been right on this, but like in the muscle and on the external part of the uterus. And I got all of these, and then something told me like I need to really check her cavity. So I actually had to do a little damage. I had to cut, open up, and then put my finger in there and feel around, and I found fibroids that were in here and that were stuck in the muscle in here, and I had to get them. But if I never cut open, I would have gotten all these ones that were out here, and I would have never got these because I never breached that. But I went in there because something told me that it was some in there and I needed to check. But not many people are going to do that. You know, that's just from doing this enough and being thorough enough and caring enough to remove all the fibroids to get them all out. I think somebody, you want me to answer one of these, put one of somebody
Yeah.
on.
That's fine. We can go rotate. Now remember, mini
Then,
consultation today.
you can ask her. Hello?
Several times, and you already know this, even when you said to me. So anyway, fast forward, what else are we doing? Hey. What y'all doing? Wait a minute, I know what y'all doing. But anyway, I had a question because my daughter, hold on a minute, I'm trying to watch YouTube. I'm watching everything. I ain't got no business watching right now, listening to you. But that's what I do. I can multitask because I'm at home every day. Wait a minute, let me keep my hair down. You know what, Doc? I was kind of upset when you were saying about this lady's fibroid and the doctors or whoever wouldn't take care of her and your anesthesiologist. But I done breathe a little bit, so I'm okay right now. Look at my baby girl. See my baby girl over there? She got the same color hair I got. Mine's just lighter. But anyway,
Purple.
my daughter told me, she said, Mom, can you please get this question to Dr. P? Because she works for the airlines. That's why I be flying all over.
Mm-hmm.
But anyway, she works at this time, and she wouldn't be able to be on the live. She's having, oh, now I'm really going to tell my age now, huh? She's having challenges with
Okay.
menopause. And she said, Mom, it's just so weird. I know because she reads a lot and she understands what it
Uh-huh.
is. But she says, Mom, it is just so weird that I can't get control of it with everything that I have naturally kind of told her to take, and things like that. So I'm kind of wondering, is there anything different that she can take other than, I know she's doing the I want to say black seed oil. She's doing that because we try to do as much herbal as we can. And then she's doing what's that other one called? Rose, somebody's name. I don't know. She's taking that herb. But she says she's just having a hard time with it. And I think one of the problems is she just getting older, right? And she just can't believe it because that's the same thing I thought too. I said, I'd be damn. He always talking about this word, you a bitch. Let me tell you what a bitch is. Getting older. Now, that's what a bitch is, okay?
Yeah, so there's a couple comments in here talking, about primrose oil,
Yeah.
like black coal hash. Like there are several different. Those are two. St. John's Wort is another one. Herbal supplements that have been shown to be effective with hot flashes. It doesn't work for everybody though. I would say this: understanding the mechanism of what's happening with menopausal and hot flashes, it kind of goes a long way with it. So estrogen helps to control the thermoregulatory centers of the body, right? When your
Okay.
ovaries start to fail, you start to lose you start to lose estrogen, and then you lose the ability to regulate the thermoregulatory centers in your body. What does that mean? That
Yeah.
means now that very small changes in temperature in the external world will cause your body to be confused and to flame up or heat up or to like change your internal temperature in just small responses to this external temperature. Because before it could go to it could be hot all day and be 90 degrees and then drop down to 50 degrees, and then your body will have the thermoregulatory centers control that, right?
Mhm.
Normally when you lose the estrogen, it doesn't do that. And that's not for every woman. It's for certain women that have it really, really bad. And so, with that being said, understanding that you have to be able to control the external environment. So, what I see often are women are trying to get ahead of it. Like for instance, you go to sleep under the fan with the air conditioner on, right? So
Yeah.
you do that, and your internal temperature is like, oh, she trying to freeze us out. Oh, okay, we got something for her, and so you flame you up on the inside because you don't have any regulation of that. Whereas
Yeah.
if you keep the external temperature normal, like and have
Hmm.
normal room temperature, sleep, with moderate clothes on, your body doesn't go through these changes, and you'll decrease.
Mm.
So that's just one, just understanding how that happens, and not going outside talking about I ain't gonna wear no coat because I'm gonna be hot. Okay, well, body, we got, what I mean. So just understanding what's happening and kind of jumping out on that will help significantly. In addition to that, before getting to hormonal replacement therapy, which that's like the last step in doing this. SSRIs. People think like antidepressants are all just for people with depression. Not. They're also used for women with hot flashes as well. And the medication we know is like Paxil or paroxetine. is also very significant. It's a specific SSRI or antidepressant that significantly helps women in these positions.
Wow.
Also, too, hang on, just lost my train of thought. Yeah, that was that was big. I had another thought up there. It kind of eluded me. But those are things that will significantly help with, like, oh yeah, treating the symptoms, right? Some women don't have necessarily hot flashes, they have vaginal dryness. So instead of, treating the vaginal dryness, they want to go to hormone replacement therapy, whereas understanding that you may just need a lubricant, right? So with
Mm-hmm.
of course, things like you can use lubricants and don't need hormone replacement therapy if dryness is your only issue, and not as some people just don't want to use messy, lubricants. Some of these water-based lubricants. If you use a silicone-based lubricant, it's like slick like oil, so it's like a couple drops and everything is not super messy. So there's a lot of tricks that you could use to counteract
Okay.
some of these menopausal symptoms before utilizing hormone replacement therapy. Is just understanding what's going on and kind of being smart about what's happening.
Okay. That sounds good because she was asking me, she said, well, Mom, what did you do? I said, well, I didn't go through menopause. And she said,
Mhm.
what
Yeah,
do you mean? I said, I didn't. And if if I can answer it correctly, I'm going through menopause now. To me, I'm going through menopause because my body is jacked up. Okay. My hormones don't know what they doing. Okay.
you living
And
life, you good, mama. So don't be too hard on yourself. Like, life is
life
good.
is good and I'm grateful. I always have the attitude of gratitude. But let me tell you, mm-mm, this is something else. Anyway, it was raining here and I got to go out yesterday and I did a video. I said, "Ooh, you guys, I'm outside. It ain't raining in sunny California."
Hmm.
And I'm so happy I'm outside. I was just looking at the clouds and just having me a good time. But anyway, that's what I do. That's how I manage everything that I do. I just manage me, to do. It was just hard for her. She would say, "Mom, what did you go through?" I didn't go through anything.
Yeah.
Because when I was growing up, I heard people talk about menopause and didn't really understand what it was, how women would lose their mind. I remember that so much as a child. Lose your mind? What is that?
But
I see
I
it.
talk to people like this too. It's like, when you look at, like, if you give me like 100 menopausal patients, I would say maybe 10% of them really don't have any symptoms at all. They're perfectly fine. 80% of them have an occasional hot flash, some vaginal dryness, things that they could get through that don't really impact their quality of life. Less than 10% of them are the ones that have these major problems, like consistent hot flashes, can't function, vaginal dryness, don't enjoy sex and stuff anymore. It's a minority of patients. The reason why we hear them so much is because their voices are louder than the other 90%, because we always hear the negative stuff first.
Yeah,
So it's like
that's right.
every very fearful of it, because like you hear all of the bad stories, but the overwhelming majority of people that don't have those issues, they get kind of drowned out by the 10 with all of these horror stories.
Yeah. Okay, thank you. Because those are some of the, when you named all them pink ladies, that's what I call them, the pink ladies. But I noticed she was taking one of those too, and that's what she was saying. It just doesn't seem to help her, but that's good. Good information.
Mom, we appreciate you. We'll get up with you soon.
Okay.
Um,
Thank
we'll
you
I'm
for
coming to
joining.
Chicago. I'm coming to Chicago just to see y'all. But
come
anyway.
on, come on.
Come
We
on.
Hey, I ain't coming out. It's snowing, ain't
Nah,
it?
it's over with. We good.
Really?
we
Yeah,
good.
come on
It's
Mhm.
over
outside.
with.
Yeah, it's over
It's
with.
get
Well, don't
We
say
might.
it's
Oh, we
over,
might.
but
Oh, let me shut my mouth.
right. Well, don't say it's over, but we
Yeah,
dealing. We not dealing. It's cold, but we
yeah.
not dealing with snow.
okay. Well, it's
And
too cold. This is sunny California, and we had rain, and we almost passed out.
come holler us in the summer.
Okay. Thank you
All right.
so much.
Talk to you later. All right.
Appreciate it.
All right. If you just joined in, please put your questions in the question bubble. It's definitely fine
So
to talk.
you've been looking at all of these. Okay.
Yes, it's definitely fine to talk on the chat, but please put it in the question bubble because when it flows off the screen, then I miss it. All right. So next question is submitted, and then I'm gonna go back to the chat because I gotta go back and forth, back and forth.
And
When I get my
putting we can't follow them in these comments down here. I was seeing some stuff down here, but it's hard to follow them. So put them in the chat bubble so we can address them. So it's very
you
difficult to do.
use the bubble with the question mark in it, and it'll stay on the screen for me.
And for everybody, well, somebody said, "Can I get a love console?" Just hop on the live. Here you go. There's your console right here. So it's your opportunity.
Yes, you can still request to join. Just don't bring all 10 of your questions tonight. Bring a small amount so we can keep going, because thank you for keep returning, but we want to make sure everybody gets addressed. All right. When I get my mammograms, they often ask me to come back for an ultrasound because they say I have dense breasts, which they say is common in Black women. If the ultrasound gives them a better look, is there a reason the ultrasound is not the first exam and the mammogram is the secondary procedure? It seems like the ultrasound would be less painful for women, and then the mammogram would be the secondary if they detect issues, since it's so uncomfortable.
No, I would say that's a great question, but ultrasounds detect more so the difference between like cystic tissue versus uh, malignancies. Like if you just have a cyst, and some women have like multiple cysts, and the younger you are, the more dense your breasts are. So that's why mammograms are not required or recommended until a woman is 40. But the when you have more dense tissue to your breast, and you have you know when you have things that are questionable, the ultrasound differentiates better, seeing cyst when you have super dense tissue in the breast. But as far as what's the gold standard or the best imaging modality for breast tissue, it's absolutely mammograms. But in certain situations, just with like cystic formations, ultrasounds are needed, but overwhelming mammograms are the best. And I know it's difficult. It hurts. It's putting your breast in something that gets squashed like a pancake. It's not comfortable. But ask women about breast cancer. It's not comfortable either. So if that's what it takes to diagnose or to detect abnormal tissue in your breast, I think it's not too much to ask. Anything to diagnose or detect, whether it be a pap smear or colonoscopy or a mammogram, they all suck. But it's just us doing our due diligence to look out for our health, though, at the end of the day.
All right. Can you be botched from a fibroid surgery? I really feel botched. I haven't been the same since I had my
You
surgery.
can be botched from any surgery, honestly. Yeah, it's a lot of botching. I see botching every day, honestly. So,
Okay.
yeah.
Well, they gave a little bit more gave a little bit more details. I believe my fibroids came back or were never taken out because I feel botched from surgery. Everything worse after I've had endo and menorrhea and appendix removed.
Yeah. So,
Am I saying
yeah,
that right?
amenorrhea,
Yeah.
which is no periods. But yeah, bad surgeries or not surgeries that are not very thorough happen every day. That's why I tell you guys to like really, really do your research on people that are operating on you. Um, you know, if they're not operating on you, they could be thorough and you can see that. But when they're operating on you, you really got to do some research on it. And when you find somebody that you like, man, female, male, female, or transgender, you utilize that person's skills. Like you are at the mercy of another human being when you are completely asleep. It's the most vulnerable that you can ever be in your life, right? When you are completely out and someone has your life in their hands, it is the most vulnerable that you can be. So you have to be very confident in that person, and you have to have the confidence that that person is going to do right by you, that they're going to treat you like they will treat their family. And unfortunately, everybody's not like that. So you really have to do your research when it comes to who you allow to operate on you.
All right. I have 3 large fibroids one of the fibroids is congesting the ovary. My doctor is recommending Lupron or a combination of Excessa and a myomectomy for the large fibroids. What do you recommend?
I'd have to know a little bit more. I would not recommend Lupron. Lupron would be it's never necessary for when you're talking about fibroid treatment or therapy. It makes no sense. But I would have to see more, like see your ultrasound, see those things, like if it's really, and what the goal is. Excessa is more so to treat symptoms, whereas if you have a fibroid that is um, causing fertility or causing other issues, that excessive may not be the answer. So it really just depends on what the goal is and what your issues are, what the problems are, what you're trying to accomplish as to what treatment makes sense. But for certain, somebody putting you on Lupron doesn't make sense. I wouldn't put you on Lupron as a fibroid patient. Um, I think somebody else is. I think that answers the question.
Okay. You have
Somebody else.
somebody requesting to join?
Good
Good
evening. How is everybody?
Evening.
everybody. That's good. How you doing?
I'm doing good. Just a little pain, but other than that, I try to lay down as much when I get pain because last year I had a myomectomy and he removed 3 fibroids and he said they was the size of mangoes, but he said he couldn't get to the other ones because they was attached to the uterus, and he said I would have to have a hysterectomy.
They all attached to the uterus. The ones ones he removed were attached to the uterus.
Okay, so I just need to, like you have been saying tonight, do more research as far as finding someone who's going to be good.
And I talk to you, yeah, like when you hear misinformation, and that's why I do these, so everybody that listens to me can be educated, because like that's really what it's about. If you're educated about anything, people tell you things that are bad. You know, they can't just lead you when you're very educated about stuff. So education is key. And for everybody, if somebody says, "Oh, you know, it's attached to the uterus," that's not. They're taking advantage of things that you don't.
And
Go ahead.
no, go ahead. I didn't mean to cut you off, sir. Um, and the thing about it is, I'm a disabled veteran, and I go to the VA, and you have doctors that's coming in and out. They don't stay that long, and you have some that tell you, "Oh, well, we don't do this anymore," and I'd be like, "So you telling me that you're not gonna watch it?" After another doctor says she wanted to make sure to keep a track of how they growing,
Right.
but she was like, "No, we don't do that anymore." She just had a lot of different little answers and just didn't feel like she was there in the room with me.
And I would say too, for everybody that's like watching, like listen to your gut. Like if somebody's talking to you and it just don't feel right, or like even if or if they talking, they're like talking around and kind of like not answering your questions directly or not hearing you out, like those are red flags, or just not paying attention, or just kind of like the next patient. Those red flags. Watch the red flags. Don't look at like Google reviews. I'll tell you that all the time. Like pay for reviews. Um, go with your gut and how people feel when you talk to them.
Yes, sir.
That that's what I would say.
Okay, thank you for your time, and I'm gonna just let someone else get a question answered. Y'all have a great
Thanks for
evening.
joining.
Thank you, ma'am. Now, how do I get
He
on?
gonna let you
Oh,
out. He the technology guru sometimes, and he step in where I step back. All right.
There's somebody else on here too. You want me to let another
Oh,
one
okay,
know?
go ahead.
Hello.
Hey, how's it going?
Not bad. How are you?
Pretty good. And I'll try to be quick because I know that somebody else is probably just like me and have some
No
questions.
problem.
So I'll give you a quick rundown. I went to your website and I just wanted to know and see if it was possible because I've been researching doctors and following you, so I definitely think that you probably would be able to help me. So long story short, about 3 years ago, um, I went to my doctor. I just had like a regular checkup, and she called me back in later after my regular checkup, looking at my labs, and was like, "Hey, you're very severely low in your iron and blood." So she was concerned. So from 3 years ago, in my lab report, she started doing an investigation. Long story short, I had an ultrasound, found out I had fibroids.
Okay.
So when she checked me for the fibroids, she said it was maybe about 3 or 4 at the time, and they were like golf balls. So at that point, she said, well, actually, they were like different sizes. They were too big to take out, I guess, through like a histoscope. So she wanted to do a myosectomy because they were too big.
Okay.
So I said, okay, I'll go ahead and I'll do that. So I had that surgery about 3 years ago.
She
When I was having the surgery,
she
I'm sorry.
open your belly.
Yes.
Okay.
Yep.
Like what?
But the problem was,
Like this or?
um, she did this
Okay.
way. But the problem was when she did it, that's when I found out I had stage 4 endometriosis. So I had a frozen pelvic. So she couldn't even move my uterus out to really clean anything out. So from that point, I saw specialist after specialist. Long story short, I had 3 more surgeries with the robot with other specialists that they kept referring me to, and they could never get the fibroids through vaginally, through the hysterectomy or something.
Recipe.
Okay. And so then my last resort was I had a ablation about a year ago.
Endometrial ablation or
Mm-hmm.
bleeding.
Correct.
Okay.
Because at this time, for now, about 3 years, my blood has been about a count of an 8 to a 6.
Okay.
And I don't do blood transfusion. So for me, it's very dangerous and I take it serious. So long story short, now at this point, I went to all the other specialists, like even the Cleveland Clinic. But once they look at my MRI, they tell me that I'm too dangerous. I'm too much of a risk. Because of the frozen pelvic, if I have another surgery, then I can bleed out because they can accidentally hit my bladder, my liver, or something. So every time I go through all the loops and saying, the different specialists, example, the Cleveland Clinic, they tell me, well, we can't do anything for you. You probably just have to kind of live with it because you're too much of a risk.
Okay.
So just to give you a little bit more, so this is the last piece to it. So now I have a monthly habit. Every time I get my cycle, like I had my cycle last Saturday, I can just stand up and then just lose all type of blood amount. So now I'm getting accustomed to literally passing out, and I can't even like keep conscious because I'm so low. So whenever I get my cycle, I have a still severe periods to where I just can't even keep conscious because I'm too low. But I can't have surgery to correct it because nobody would do it because they say I'm too much of a risk. So now I'm at this like vicious cycle and worried about, blood not getting to the organs like they're supposed to be doing. So am I too much of a risk for you? Or is that something that could still be, or like, what is your suggestion? Do I need to find a way to maintain it, or am I too much of a high risk?
You don't mind me asking how old are you?
42.
42. I mean, it's definitely a risk. Um, I would say too much of a risk. No, it would definitely be like some precautions that need to happen. So let's just kind of break things down. So I I have not been privy to have those, to see what your doctor saw, right? So in fairness, I would be able to like say um, how bad it was. But if you've been to multiple, I don't know if those other places really relied on what that doctor saw, or did they do thorough exams and kind of look to make their own opinion about how bad your situation is. That I
Each one I did it over. So again, it's very costly. So every time I would do an MRI and pay out the pocket and have them read it, and so they did their own
so
independent information.
MRIs don't really tell the story. Actually, going in there looking tells the story. Um, so I haven't come up against a case that because they have a frozen pelvis or whatever that I haven't done. I've operated on women with frozen pelvis before, but if that was the case and we took that at face value, I would take some extra precautions. So this your situation, especially with you not wanting to take blood, um, you would have to. I would take more precautions. One, and I said I wouldn't give Lupron, like I don't give Lupron regularly. Your case will probably be one, and the reason being is because if you have stage 4 endometriosis, that means those lesions are getting fed by estrogen, by your ovaries, and that's really uh, contributing to the frozen pelvis or things getting stuck together. So it would be worth it to put you on a 3 to 6 month trial of Lupron to help with that before surgery.
I
And
did try that.
but did they do surgery after that?
Yes. And then the second surgery I tried something called I think Orahan for about 3 to 4 months,
Or,
and then
or
they had surgery.
but
So yeah.
so wait, they did Lupron for 3 months and then they tried to do surgery.
Hmm.
They do. What was the plan?
Um, and I stayed on it during surgery and actually after a little longer, but I just still bled heavy. It's like my body
But
didn't even.
when they put you on, what was the surgery after that?
Oh, that was the myomectomy.
That
That was
was
the first surgery.
that was the that was the hysteroscopic myomectomy that they did.
Um,
Lupron.
no, that's when they cut me like a C-section and went in for the first time when it had the
Oh,
frozen,
when they
because she knew I had endo, but we didn't know it was that bad.
got you. I mean, I was still can't, like, even with that being said, I can't really go off of what someone else says. So I would say what I would do. And so
Mhm.
for those that's here, like frozen pelvis, a frozen pelvis is when basically the uterus is stuck to the pelvis, really. So like it's scar tissue. Endometriosis can cause significant scar tissue to where now the uterus, the back of it, is stuck to the back of the pelvis, and even surrounding, like anteriorly, or the top part of the uterus can actually get stuck to the top part of the pelvis to where now it doesn't move readily. It's just kind of really stuck down there. With that being said, I would take your case. And more so, what I would probably do is if it's that bad, if it's a frozen pelvis that's that bad, I would probably do a what's called a super cervical hysterectomy. Whereas I wouldn't so much um, try to get down and do a traditional hysterectomy with getting around the cervix. I would take the uterus off, leave the cervix, and then remove that, which would effectively treat your bleeding. You wouldn't have any periods no more. You would still have ovaries left, but as far as the endometriosis is concerned, we'd have to treat that medically. If not, if there's continued problem with keeping your ovaries in, that will be the last case scenario, would be to go in to remove your ovaries as well. But for a frozen pelvis for a woman that needs a hysterectomy, that's the way to kind of get around it. Not everybody is skilled to do super cervical hysterectomies. Like right now, I have a patient that I'm scheduling in April, that like her doctor sent it to me because they don't do super cervical hysterectomy. So but she just wants a cervix for whatever reason. But for you, that's what I would propose. I would say a 3 to 6 month trial of Lupron, and then prepare to do a super cervical hysterectomy for your bleeding.
Okay. And do you take insurance? Because when I try to do it online, I think it was like only like a cash option.
So this is the thing. So uh, with me, a lot of a majority of my, not even a majority, like over half of my patients are coming from out of states, like different states. And so I offer telehealth visits for those patients. If you can,
And that would be me.
right.
I'm in Florida. Mhm.
So me spending my Wednesday or Friday outside of everything, my day off or whatever, is my way of listening to you, giving you all the information, doing those things, and being able to plan and prepare for a surgery. I don't take insurance for that. I just do that. That's just what I do. But if you come and see me, like if anyone comes and see me, yes, they use their insurance, like for regular visits. In addition to that, if you are getting surgery, you also utilize your insurance. I don't. It's not a cat like you got to pay for your surgery, pay for your in-person visits. None of that. The only thing that you would pay for is if you're going to do a virtual visit with me. That's a cost. That's the only out-of-pocket cost. Everything else you utilize your insurance. And for you in Florida, it's just imperative to have a PPO insurance. My office, my hospital, we pretty much take all insurances. It's not an insurance that we really don't take. So the question, people ask me all the time, like, what insurance you take? That's not the question. The question is, what does your insurance cover you for? Does your insurance cover you to go out of state, to go to me as a provider or what have you? If they cover you, for sure, we'll take it. That's not the issue. So the first call that you would make would just be to your insurance provider and make sure that you're covered out of state. And if they have a network, give them my name. The hospital is Mount Sinai Hospital, Chicago, and just make sure that me as well as the my hospital is covered under your plan, and then everything else is covered.
Okay. I think we got a plan then.
Awesome. Cool. So does that answer everything
You
for you?
did. Thank you so much. I appreciate
You are
it.
welcome. I'll talk to
Thank
you.
you for
Thank
joining.
you.
All right. We at 10 minutes.
All right.
I'll just let you know. This is what you said. All right. Please speak on the role of fibroids during menopause.
So the myth is that fibroids will just disintegrate, evaporate at menopause. Menopause will just save you. It's not true, right? It is true that fibroids will lose some size with menopause. So, and additionally, it is true that bleeding is going to stop with menopause. However, do not rely on menopause to be a treatment if you have advanced fibroid disease. Meaning, if you have 10 centimeter or greater fibroids, your belly is protruding, you like are feeling real pressure and pain and tenderness from your fibroids. You're like, oh, let me just wait till menopause comes. They're not going to shrink down, and your belly's going to get flat, and they're going to go away. It's not going to happen. So, do I operate on women postmenopausally? Yes, for fibroids, and those women typically do not have issues with bleeding. They have issues with pain and just uncomfortable, just being uncomfortable. And a lot of those women tried to wait to menopause and the bleeding stopped, but the pain and the discomfort from the fibroids still persists because they're not going to lose that much size if they are extremely large like that. So that's the truth. A lot of doctors will say, oh, just wait to menopause. They're telling you like that. A lot of times they're not comfortable with surgery and they're not comfortable with, telling you the truth. So that's really the truth of the matter. I do not like operate on women. I will not operate on somebody unnecessarily. So if your fibroids, are not really that large, you're close to menopause, absolutely, you can wait, just depending on what the issues are. But if you're there and you're just relying on menopause to save you and make them all small and go away, that's not going to happen if they're very large.
All right. What are some of the pros and cons in getting the cervix removed during the hysterectomy?
Speak on it, Cole.
Well, the pros, in my personal opinion, was I don't have to get pap smears anymore. You still have to get your well woman's visit though. So, I mean, you can't get around them going inside completely, but that cranking you open to scrape you, I don't have to get that anymore. It's much more gentler for them to just feel for your ovaries than that speculum thing and that they open you about 12 inches for a small Q-tip. Well, I don't know how they open, but to me, it always was unnecessary what they crank it up to compared to the Q-tip. I used to just be like, this makes no sense to me. So that was the number one pro for me. I personally have not experienced any cons in not having a cervix. I don't know I don't have a cervix at all. Like, I have no way of telling. I can't see it. I can't feel it. I don't know that I don't have a cervix. Like, only reason I know is because I saw my, discharge papers. But as far as feelings go, I have no feeling that it's not there. Does that make sense?
Makes a lot of sense. And I've told people, actually, the patient that's going to get a super cervical hysterectomy, she just refused to talk to you because in her mind, she is hell bent on keeping her cervix. She's listened to everybody else, and she won't listen to me. And I say, don't listen to me. Talk to my patients. Like, I had tons of patients that have had this done. Go talk to them. She doesn't want to talk to them. So it's, it's, don't listen, again, don't listen to doctors, providers, or anybody talk about something that they really don't have any experience. And that's being kind of hypocritical of myself. But I can tell you the physiology behind it. I can tell you the medical aspect behind it. I can tell you everything that you need to know from the nuts and bolts of it. I can't tell you what it feels like because I don't have a cervix. So for that, that's why I deflect to someone that has been through it and does not have, whatever they're trying to, or how is sex after, how is the cervix. Like, I have to deflect because I personally have not experienced that. So when you are, it's a very fine balance, and that's why I think this, I do these, and I think it's so important because it gives you the opportunity to see like all the logistics and stuff that doctors don't want to tell you or whatever, but it also gives you the opportunity to talk to somebody that's been through it and understands how it truly feels. And that's important when you're choosing your surgeries, choosing your surgeons, just getting a full scope of what it is you're trying to go to and go through, to get a better understanding of what you need to have done.
And one additional pro was without a cervix, there's no chance of getting cervical
Facts.
cancer. So that's one less body part that I had to worry about. Could it possibly end up with cancer? Whether it is genetic, whatever, running your family, whatever the reasons people get cancer and then no family history. But it was always one less part of your body that you have to worry about could develop cancer. So that was amazing. To me, that was a benefit that outweighed any risk that I had heard that you could have, in my opinion.
One other person that was on here, I'm gonna let it drop on.
All right.
Does removing the cervix affect your sex life? No. Well,
You had your cervix removed. No.
it doesn't bother me. And from a man perspective, I tell you, nobody, it doesn't bother the
right.
man.
That's what I was gonna say. From a man's perspective, my husband has no idea if I do or don't have a cervix, and I don't have any idea if I have a cervix or not.
Awesome. All right.
He's never been like, "Oh my God, your cervix is gone."
Oh,
He's never.
Something ain't right here. Like,
He's never said that.
The little knob, the little.
He's never said that.
I tried to. Oh, she's unable to join. I don't know what's wrong. So, Ms. Howard, I tried to let you join.
Okay.
So, all right. I guess question. Let me see.
Yeah, you tell me what you want to hurry up and grab. I'll let you take over.
Nah, go ahead. Just go ahead.
You sure?
Yeah, go ahead. A couple more.
You at your thing?
I know.
Okay. How long is the hospital stay for after removing fibroids?
If you're trying to save your uterus and getting a myomectomy, usually it's 2 days, maybe a day if it's really not that complicated. But saving your uterus takes time. If you got a ton of fibroids, you got 50, 60, 70. I took out like 80 something fibroids last week. Like, yeah, it takes time. You're there for, in surgery for 4 hours. I'm in there just picking stuff out. You're going to be there 2 days. But if it's small, like I had a patient, actually, today, she got discharged. Yeah, I did Tuesday. She had a myomectomy, was discharged Wednesday. She was there 1 day because she had really small incision and her fibroids really weren't that big. So it just varies on like what your issue is and how difficult your surgery is. but no, typically no more than 2 days. Now, sometimes there are issues that happen. People have other things that go on, really, really difficult surgeries. Sometimes it may be 3 days, but rarely does that happen. Usually it's about 2 days, you're good to go.
All right. Right. I am post menopause at 2 to 3 years. I have three fibroids that are about the size of an orange. They don't cause me any pain and I don't get cramps. Sometimes I do get discomfort with core exercises occasionally. The doctor discussed a hysterectomy with me or the possibility of just keeping the fibroids. What is the risk of keeping them?
There's really no risk of keeping them as long as you're comfortable and they're not significantly impacting your quality of life. I do agree with your doctor that you don't necessarily have to have surgery. However, if they're impacting your quality of life, then yeah, surgery is an option. So really, it comes down to you. Can you live with them? They really, really impacting you, or stopping you from doing the things that you normally do comfortably. And if the answer to that is yes, then yeah, surgery is an option. If no, it's very rare. It's very unlikely that they will ever turn into a cancer. So I would not, just remove them just because. So it really just comes down to a quality of life issue.
All right. Is a hysterosonogram necessary to diagnose fibroids?
Uh, Hysterosonogram, I would say an ultrasound. You could feel fibroids very, very easily, like with the exam if they're big enough. But yeah, an ultrasound is one of the easiest or quickest ways to diagnose fibroids. MRIs are the gold standard, but MRIs are expensive, which is why we don't just order MRIs very readily. But you definitely can um, diagnose with a ultrasound. But as far as a saline sonohystogram or a hysterosalpingogram, those are modalities that are more so looking at the entire pathway to see if the tubes are patent, to see if there's anything inside of the cavity. Those are what those tests are for.
All right. I couldn't get my OB to approve an ultrasound or an MRI for a consultation. What other ways could I obtain one?
You said you couldn't get your OB to approve an ultrasound or MRI.
For
That's
a consult. That's what it says.
get another OB. I mean, it's nothing to really to order an ultrasound or MRI. That's easy. So if your OB doesn't agree to give you an MRI or ultrasound, um, that's weird. If you definitely have fibroids. Now, if you have fibroids and you just had an ultrasound or MRI, then you won't really need another one. I would say if you had an MRI or ultrasound within 2 years, then that's fair enough. You don't really need another one. But if you have not had one, then they should give you one. And if they don't, then you just get another provider.
All right. Um, I have three.
$50 for an MRI. Oh my God. What they for the surgery?
Right.
Well,
That's expensive.
tell me where they
All
at.
right. I have three small fibroids and endometriosis. The endometriosis doc cleaned up the endometriosis but didn't remove any fibroids. Should I have them removed if the doctor says that they're not in the way?
If they're not causing you to have problems, I mean, if you don't have significant bleeding or pain, then no, not necessarily. You don't necessarily need to address them. They're just there. So really, it just comes down to a symptom standpoint. If the symptoms are causing you to have major issues, then yeah, you can address them. But if they're small and they're not in the cavity of the uterus, chances are they're not causing you significant issues. So you don't necessarily need to do anything.
All right. What is the recovery after a robotic myomectomy?
So I'm not a proponent of robotic myomectomies anymore. So I've had this conversation, but I'll have it again. Robotic myomectomies, are great, but if you are seriously Um, trying to not deal with fibroids again. You're trying to remove them all. One, robotic myomectomy, you're going to have some left. So if you're comfortable with having some left, then okay. But then two, realize that uh, when you do myomectomies, you cut into the uterus, you're obligated for a C-section. So if you're doing this to preserve your uterus to have children in the future, you have to have a C-section. So it makes more sense to make a small incision down low to be able to get all of the fibroids out and to be able to utilize that incision for future C-sections. Uh, but if you're just talking about robotic myomectomy, let me answer the question. If it's straightforward, you can be out of the hospital in 24 hours. If it's more complicated, you're in the hospital for 48 hours typically.
All right. Um, are there any foods that you recommend that you stay away from to eat for fibroids? Can you starve a fibroid to shrink?
No, fibroids are not fed by food; they're fed by estrogen. So the myth is that if you don't eat meat, fibroids will shrink. That's false. I operate on vegans, vegetarians, and people that don't eat meat. If you don't eat dairy, fibroids will shrink. Like I said, vegans don't consume dairy products. I have multitudes of vegans that I've operated on. So there's no study that shows any food linkage to fibroid growth or uh, diminishing size with eliminating certain parts of your diet. So it is a myth. I'm probably gonna do that in one of my little things and just say that is definitely a myth. But people can choose. They call me crazy and say everything or whatever. Like I only speak in data driven facts. You'll never hear me talk about something that I'm sure about unless I know that there's a study behind it. So when someone shows me a study or randomized control trial of people that have eaten meat, dairy, or anything else that you say causes fibroids, and then give me 1,000 people that don't do that, and then you show both of those people over 5-10 years and show their fibroid growth or what have you, and show me that there's a statistical difference in the people that did not eat the meat or dairy or whatever it is, then we could have that conversation all day long. Absolutely, I would I will scream from the rooftops, don't eat meat, don't eat meat. So you want to shrink your fibroid. But until you show me that study that has that, then we can't really say it's true. It's just false information. And I have women all the time, that want to argue about those things. Like what that woman argue with me about? Um, she argued with me about the damn castor oil. You know, it's like I know my periods got better with the castor oil. And after I sat up here and explained to you, there are multiple layers in your skin, right? That this damn oil has to get to. That's like me saying, this is going to make my penis get big or something. Like it's just like it doesn't make any sense. There's no physiological reason why chapstick is going to make penile growth, or castor oil rubbing it on your belly is going to now magically seep through your skin, seep through your muscles, seep through your fascia, seep through this just to get to your uterus and now magically make these damn things shrink. So it's like it's not like you when you talk or you speak about facts or knowledge, you have to be very, very specific about things. And that's why um, we get the short end of the stick as far as medical medicine is concerned, is because there are many things that are not told factually to us, and people take advantage of our ignorance. But if we perpetuate ignorances, bad things are going to happen to us. So I'm not about perpetuating ignorance. If I don't know about it, I promise you, I'll tell you to go to somebody that does know about it. Or I'm the first to say, I don't know that. Somebody asks me a question, I'll tell you, like, I'm not confident in my answer. I'm not confident in those things. I'm not big enough to say there's something that I don't know. And it's too many people that don't stay in their lanes to say, hey, I don't know that, right? I'm not going to get up here talking about, you know, the nuances of lashes or extensions, because I'm not that guy. I don't know. I will tell you, if you get on here asking me questions about, you know, what the best lashes, I don't know. I will be confident and say I don't know that. When it comes to fibroids, I do know, and so I speak on that. But people, you got Google doctors all over the place that I know. I swear to God, I know he don't know what he's talking about. It's like, okay, you know, it's like if everybody stayed in their lane and they knew exactly what they were good at and gave those gifts that they're good at to other people, we would be so much better as a society. But everybody's an expert at everything nowadays. So just be very careful about what people tell you, and look at motives for why people say things the way they say them or why they say them.
All right. This one is for us. I'm 42. I don't want more children, but I worry about having a whole hysterectomy. What about if I just leave my ovaries to not throw me into menopause? All right. So I was 42 years old when I had my surgery. A hysterectomy is just removing your uterus, and you can decide if you want uterus and cervix or uterus and leave the cervix. Your ovaries is a whole different procedure. So if there's nothing wrong with them and they are healthy, that should not even be a suggestion to have them removed, because you still need your ovaries for a lot of things other than just producing estrogen for your to make a baby. You need it for bone health. You need it for, and then I'll let you fill in the rest.
The heart help, you was going, you was on it. You was on it.
That was.
Going.
I done learned a lot in these
Man,
2 years.
I
I
was,
done learned a
I
lot.
love, I love in Daddy was like, get on here.
Right. I done learned a lot. I'm low key the little assistant.
Get it. Everything she just says, I echo it. I just had this conversation. The tough question that I have to ask about removing ovaries are for women that I call in the gray area, right? So so when you talk about anything, no matter what it is risk versus benefit. So what's the risk of whatever you're doing compared to the benefit of whatever you're doing? No different when you talk about hysterectomies, right? So you get a hysterectomy performed because your uterus is making you sick, it's making you anemic, it's causing you pain, it's impacting your quality of life. So the benefit of taking it out outweigh the risk of keeping it in and the problems and the things that you have going on in your body. Taking the ovaries, just like Cola said, they're separate organs from the uterus. They're attached, but they're separate. So then you look at what the ovaries do. The ovaries produce estrogen, progesterone, and they release eggs, right, for pregnancy. At a certain juncture, the ovaries stop producing significant hormone. They always produce a low level of hormone, but menopause is the official point where they stop producing any significant hormone production. And so when they're, it's important, as Cola was saying, when they're producing hormones there, it's very important for your heart health and bone health. So if you remove the ovaries from a 42-year-old woman or from someone that's younger that has significant amount of ovarian life left, then you actually decrease their life expectancy, right? So and again, that's not to say that you don't do it, because there is issues like endometriosis and things to where you do take them, but then you will replace them with hormone replacements. But back to the point, is that heart health, bone health are very intricate as it pertains to the estrogen production of your ovaries. So if you have a young person that is getting a hysterectomy, they have many years of estrogen production still left. You don't remove the ovaries because they need the production of the hormone. Now, the gray area comes in when the hormone production really dwindles, and then to the point it stops, and that happens 48, 49, 50, 51, 52. That area is when patients have the option of saying, hey, I don't necessarily have a lot of ovarian life left. What is the benefit of keeping them? Well, one benefit is that, yeah, you may have a few months, few years left of this hormone production. What's the risk? The risk is that ovaries, for ovarian cancer, the risk of ovarian cancer is 1 in 9 for women. That risk increases as you age. So the risk of ovarian cancer is still there. So the question is when does the benefit outweigh the risk? And that, to me, that answer comes when the ovaries really stop producing hormones. You need a hysterectomy. You're going in to perform a hysterectomy. The risk of removing them and eliminating the risk of ovarian cancer in the future. Now there's a question about benefit and risk and when that overtakes it. For postmenopausal patients, you know, the decision can be easier. It's like it really isn't producing any more hormone. Your risk of ovarian cancer is still there. You have the option. It's always optional. It's never somebody to say, hey, you have to get your ovaries removed. You have to. It's optional to be able to do that or not. Again, I go back to what I tell my mama. And if she's still on here, I would say the same thing. I hope she's listening. But I would say if my mama needed a hysterectomy tomorrow, my mom's is menopausal. Her ovaries are not producing much hormone. So if she's to have a surgery performed, yes, by the way, if she had a surgery done, I would be doing it, and she would have it no other way. So for everybody that has something to say, I would be doing my mama's surgery. But if she needed it, I would tell her mama, take your ovaries out. Like I don't want to be dealing with this in your 70s or 75 or 80 in your glory years, and there's a cyst to come up on your ovary, and we now questioning if it's a cancer. If I'm already in there taking your uterus out, I'm taking it out. I want it to be out. But again, that's different for everybody. People don't have to necessarily do that. That's just what I would personally recommend for my family at that age. But you could do really kind of what you want. It's just about having the information and then making an informed decision. And I can't make it any more informed than that. But I always believe in autonomy of people making decisions that make sense for them. As long as you have the information, whatever decision you make, like people say, oh, you just want to take people. I don't want to just take nothing. I have, as a human being, I have opinions about what people should do. If they're doing something that I don't feel makes a lot of sense, then I would tell them very honestly that I don't feel what you're doing makes a lot of sense. But at the end of the day, you are the captain of the team. The team is me and you. I'm the doctor, you're the patient. But at the end of the day, the decision of whatever surgery is yours. I could have an opinion, but I'm going to do what you want to be done. Just like I had a patient a while back, and we talk about it all the time. She's a phenomenal woman, but she was menopausal, and she wanted a myomectomy. She didn't want no kids. She wanted nothing. She wanted her uterus returned to her body. She was going to go through whatever. This big surgery, had huge fibroids, and she wanted a myomectomy. And I thought it was crazy. It's absolutely insane to do it. At the end of the day, I'm still pulling out fibroids out of her uterus and restoring it as if she was 40 trying to have a baby, because I counseled her extensively. I gave her all of the information, and she chose that for her body and her life. And I can't say anything about that, no matter if I agree with it or not. It may not be my opinion, but it's your body and your decision at the end of the day. So you have to have people to think like that. It angers me when people think that I don't think that way, because I 1000% think that way. I just try to give information and let you make informed decisions. But every doctor should do that. They don't, but they should.
Oh yeah. When we first started this journey, a lot of people was in my inbox saying, "Oh, he's sterilizing you and he force feeding you hysterectomy," and I'm like, "Nope." In my visit, Dr. Johnson actually said, "If you want to keep it and donate it to the Smithsonian, I'm your number one fan. I got you. Whatever is your decision." I told him that's what I respected about you the most, is that you really truly said, here are your options, but it's your decision. And just call me when you make it, because you got to go fast if you're going to do plan B, you know. So, but I tell people all the time, like, you literally did say that. You was like, I mean, I don't know what I'd be putting back, but yeah, we could do that too. You was honest. I love that. For sure. All right, well, definitely at an hour and a half.
We here. I think this is the time so I can take my black behind home, get up out this office.
Yes. So we can end right here.
Yeah.
Okay.
Sounds good.
Let me screenshot real quick before we go. Okay, so while I'm screenshotting, please tell the people two things. Tell them how to get in touch with your office and how to book virtual consultations if they can't come see you in person. So tell them that while I do this part. Please.
Virtual consultations are here. And I will tell you. So the reason I don't post my office information because of this. You're not gonna call me from California saying, "Hey, I just want to schedule." I do not do virtual consultations in my office. It bogs everything down. That's why I stopped just doing it. It just kind of like ruins my day because a lot of these virtual consultations are in excess of an hour, hour and a half. I've spent virtual consultations with 2 hours with people because my belief is I do not shortchange anybody. I don't microwave anybody, right? So with that being said, I just don't give my office information unless you plan on coming to see me in person. If you plan on coming to see me in person, then absolutely you can have it. So you DM me, even if you want to. I have patients that they don't want to do virtual consults, they want to see me in person. You can come from wherever you want to. I had a lady literally flew up from Florida, came to see me, talked to me, flew back the next morning. I don't have a problem with that. I'm not trying to just like rob you of a consultation fee. If you have the insurance and you want to come and see me in person, perfectly fine. If you are wanting to do a virtual consultation, go to the website. I understand. I get it. I heard every story in the book. That's just what it is. But if you really want to see me in person, you can DM me. I'll provide you with my office number. Actually, my office number is Mount Sinai Hospital. It's my hospital. My hospital is in the Lawndale community in Chicago. If you really scroll back, you really want to know, it's in my past stories, like when I first started at this office. But
yeah, you can DM me too. I give it to people all the time.
Try to curve by, because the reason, again, if people will not hear what I'm saying, so that's why I'm not doing it. But if you try to curve by and go around and do everything and call my office, they're going to tell you, if you are out of town, you're not coming to see him in person, the first visit is going to be virtually. Go to the website to do it. That's why I'm putting it up there. But again, if you are in the Chicagoland area and you want to come see me in person, I will have no problems. I'll give you my office. You can call my office and schedule an in-person visit. No problem. Even if you're out of town, again, if you want my office information, say, "Hey, Dr. B, I just want to come and see you." No problem. DM me. I'll give it to you.
Absolutely. All right. Now, we always save the lives, so they will be on Dr. Johnson's page. I put it on YouTube because if you have somebody that doesn't have social media and wants to have this information, or you want to share it with someone who doesn't have information, please do so, because again, we can't stress enough. The more you know at your doctor's visit, the better chance you will be getting proper care, and the better chance you will not have to deal with health in a crisis situation because you took care of it earlier than later.
And I will say, last thing is, like, again, if you are really thinking about it, don't sit on it. This is starting to grow wings. Like, people are coming from now. It's actually starting to open up internationally. Um, it's only one of me, so like it's starting to book up like kind of crazy. I'm trying to fit everybody in, but if you just like think you're gonna call and get in next week to get surgery, it's not happening like that. Realize that a lot of women want to save their uterus. That makes it more difficult because it's aligned to do that. So if you want it done and you have an idea of when you want it done, it's best to do it earlier as opposed to waiting until later. Because I can't, like I said, you want to pay to expedite your service, you can. That means I have to overwork and overbook myself to do that. But I don't try to just force anybody to do that, tell anybody to do that. I would just say, look, if you're really thinking about it and strongly considering it, don't wait, like, because it's starting to get kind of crazy a little bit. I do have a life too. So because June, July, like around my birthday time, time out. It's a mental health.
Say it's summertime shot. We only get 90 days.
Yeah,
We gotta enjoy
outside.
it.
Listen,
Man.
Chicago is the best place in the world from like the last week of June to like the third week of July. Best place in the world. I'm outside.
Yep.
After that,
Yep. Yep. Absolutely. Well, I told you, 90 days of summer. That's what we get.
that's
So
all
we capitalize on
we live it. We outside.
it. We capitalize on it.
All
All right. Well, Dr. Johnson, I definitely appreciate you.
right.
This was great. Always a pleasure. And we will do it again in maybe 2 weeks, or we'll coordinate.
Yeah, 2 weeks.
I'll check up with you.
For sure. For sure.
Because
Everybody.
next week is the twins' birthday, right?
It is. Yeah. I'm sure my daughter on here. I told him, look, y'all about to be 17. We not. This ain't Chuck E. Cheese no more.
They don't want the real expensive gifts no more.
Out your pocket, it's over with. So if you don't come up with it, we're gonna be at home watching TV, eating ice cream and cake, chilling. Because I'm that.
Hey, it's just being thankful to be alive nowadays.
The word, I'm like, y'all about to save me some money. Okay,
right.
That's cool.
You got to tell me ahead of time.
Tell me.
You know these young people, they don't plan. They wait till the day of and think, okay, I need you to pick up this person, this person, this person. We all going here, and yeah, we need you to pay. That's exactly how it goes.
Y'all have officially crossed the threshold. It's over.
Yep.
I'll pay for it, but I ain't planning nothing. It's over.
Yep. All right. Well, thank you again, and we'll be talking. Good night, everybody. Thank you.